Sorry. Just been reading a book on anti-gravity. I can't seem to put it down. But good to see you again. My name is Dr. Oliver. I see you're here for your routine medical checkup. I can see it's been a few months since you've been in, but today you have nothing to worry about. No invasive procedures are planned. We'll simply go through and assess some key health checks to make sure everything is working as intended. But before we begin, please take a seat, make yourself comfortable. Yeah, and just a few preliminary questions before we begin today's assessment. Starting with an easy one, your full name and date of birth for me. Okay. Thank you for that one. And how have we been feeling lately? I see. And how about your energy levels? Perhaps some fatigue or maybe energetic lately? Okay. What about your sleep? Has that been fairly consistent or uninterrupted? Okay. I'll just make a note of that. And that's been fairly consistent. I see. Have you been experiencing any recent headaches or dizziness or lightheadedness? Okay. What about any pain or discomfort, soreness, aches? I see. And if you had to rate that pain on a scale of 0 to 10, 0 being no pain, 10 being absolute worst, what would you rate that pain? Purely subjective. It's whatever you feel. Okay. I see. Okay. Thanks for telling me. Alright, what about your appetite recently? Any loss of appetite or... Okay, been alright. And just checking you haven't been hospitalized recently, or perhaps a change in medication or allergies that I should know about. Okay. And no recent illnesses as well. Flu, cold, coronavirus, COVID. Okay. All right. Negative for all of those. That's good. All right. And lastly, have you been keeping active lately? Yeah. That's good. Been seeing the physio maybe? Yeah. Good to hear. All right. Thank you for answering those for me. Just gives me a rough idea of your lifestyle, if there's been any major changes in the last few months since I last saw you. So thank you. We might move on now to our first routine check, and that is to do with our posture. So just while you're sitting there is fine. I just want you to look forward at my nose or an object perhaps behind me. Just focus your gaze on that, and I'll just observe your posture in your neck and shoulders, so we can carry a lot of tension through those areas. Yeah. That's it. You can focus on my finger if you like. Just observing your neck and shoulder posture as you sit. Alright. everything's looking normal so far. Alright, don't seem to be carrying any signs of distress or discomfort through your facial features, no grimace, anything like that. So, yeah, it can be quite telling. Alright, and just while you're there, do you mind rising up those shoulders for me, almost like a shrugging action, like so? Very good. Just want to feel that motion up and down, up and down. Okay, good. And just while you're sitting there, take a nice deep breath in for me, in through your nose, out through your mouth. Okay, I'm just going to have a look at the rise and fall of your shoulders and chest. Focus on my finger here. Nice deep breath in. Hold. 3, 2, 1. Exhale. Good. Same again on this side. Inhale. Hold. 3, 2, 1. Exhale. Very good. Posture's looking like no abnormalities detected. Just make a note of that. Alright, moving on to our next test. Just going to observe your eyes. Now, hold still for me. Just with my light here, I want you to follow it as best you can. That's it. Just with your eyes. Very good. Horizontal movements. Nice and steady. Very good. Alright, now just up and down for me, vertical. Following the light with your eyes as best you can. Very good. Follow that light. Good. Keep going, just observing your pupils here. Good. Okay. Just in a diagonally. That's right, diagonally. That's it. Just do your best for me. There's no right or wrong. Okay, that's good. And just this direction, diagonally now. Good. Almost done. Okay, very good. Now just focusing on the tip of this little pen light for me. That's it. Just going to move it closer to you. That's it, converging and moving further away. That's it, stay focused on that one. Moving close in. Hold that gaze and away. Hold that position and away. Very good. Okay. Now, just with my light again, looking forward, either at my nose or behind me, over my shoulder, just pick an object. And I'm just going to check your pupillary light reflex. That's it. As we expose the light there to the pupil, should start to constrict. That's it. Just a protective reflex and response. It's all looking normal thus far. Alright, just checking from this angle. How's that? Not too bright, I hope. How about from this angle? Very good. just one more time on this side. Just keep looking forward for me. Okay. That's looking good. Fantastic. Now, just checking your peripheral vision for me. Focus on my nostril here, or my nose, or my finger if you prefer. That's it. Just tell me when you can no longer see my 3 fingers here that I'm holding up. That's it. Can you still see these? How about now? How about now? Now. Okay. And again, tell me when they disappear. Okay, good. One more time on this side. Okay, very good. Swapping sides now. Just focusing on my finger or my nose here. Tell me when you can no longer see these 3 fingers. Okay. Good. One more time for me. Nice work. Peripheral vision seems to be working as expected there. We'll just make a note of those findings. And looking good so far. All right. Let's have a look at your ear now with my little device. So we have here what's known as an otoscope. So I'll just pop this one inside your ear. Just allow me to see your ear canal for any sort of signs of infection or any nasties, bacteria, etc. So I'll just prod this one in this ear. Okay, that's it. Just having a look through there. Alright. Just holding still for me. I know it's a bit uncomfortable. Can feel a bit funky. Okay. Canal's looking quite clear. A little bit of earwax, but that's normal. Not completely normal. Very good. Okay. Alright, and just trying the other side now. Okay. Still looking ahead for me. Good. Alright, just checking out this side now. Very good. Similar story on this side. Ear canal's clear. Everything. A little bit of earwax built up, but once again, perfectly normal amounts. Nothing to be alarmed over. Okay. Very good indeed. Now, just while you're there, I'd like you to open your mouth for me. Say ah, nice and wide. That's it. Like you're at the dentist. Yeah, exactly. Okay. Hold that position now, just observing into the oral cavity there. Good. Nice and close. Sorry about my breath there. Just had lunch. No signs of lesions or issues inside the oral cavity. Now, just repeat after me nice and loud. I want you to say the following. Okay? Apple, penny, table. Apple, penny, table. Okay? Alright, just try to say that now while I look into your mouth. That's it. Apple, penny, table. Very good. Okay. Now, I want you to remember those 3 words for me. That's it. Apple, penny, table. I will ask you what they were at the end of today's assessment. Just testing your memory. Okay. And while we're at it, can you count backwards from 100 for me in lots of 7? Okay. For example, 100, 93, etc., etc. Okay. Yeah, just count out loud for me so I can hear you while I write this down. Okay. Good. Keep going. All right. That's perfect. You can stop there. And just while you're there, breathing in through the nose for me and out through the nose. Just observing your nostrils. You're able to breathe through both nostrils today. Okay. Just go again. Just breathing in through the nose and out. In through the nose and out. Okay. That's good. Yeah, I can feel the air on both nostrils there. That's good. Now we're going to check your, what we call our vital signs. Just a bunch of key health measures that tell us whether there's anything alarming or anything requiring further investigation. So first thing we'll have a look at is actually your lungs, what we call auscultation. A little stethoscope device here. So all you need to do, just sit where you are. We'll just plot this on over your shirt is fine, just so I can listen to your breath sounds of your lung. Okay, we'll put this on a few points on your front and then your back area. All you need to do, take a nice deep breath in through your nose, out through the mouth. Okay, exactly like a deep breath. Just keep going until I say stop. Okay. All right, here we go. All right, go for it. Keep going. All right, I'm just going to do the back now. Lungs are fine. Good. Let's try it now. From the back. Good. Again. Just leaning forward for me slightly. Yeah. And again. All right. One more time. Fantastic. Okay, so yeah, just listening out for any abnormalities such as maybe wheezing or crackling noises in your lungs themselves, but you haven't been feeling short of breath or coughing lately. No. Okay, that's good. Just while we're on that topic, do you mind demonstrating a cough for me at the moment? Yeah, just into your elbow area. That's it. Okay, that's good. That sounds like a nice strong cough. Yeah, just tells me about your strength in your breathing muscles to be able to forcefully expire, essentially. Okay, let's move on. So, auscultation, all okay. Now, if you don't mind, I'll just grab your wrist. Yeah, we'll just have a feel for your pulse on the inside of your wrist there. Okay, that's it. All right, hold that position for another 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. All right, and I just want to check your carotid artery there for your pulse. Same thing, just making sure nice strong pulse there on your carotid. Good. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Good. Alright, pulse seems to be okay, all within normal limits there. Yeah, within 60 to 100 beats per minute would be considered normal. Yeah. Alright, let's check your blood pressure next. Have you noticed any issues? No? Okay. Well, let's just do a routine check today. Make sure it's all within those normal ranges. Okay. Let's try your left arm. Yeah, non-dominant. Yeah. Alright, here's our cuff. We'll do it manually today as our automatic machine is broken, of course, but it's more fun this way. This is our sphygmomanometer, and it's how they used to do it back in the day. So, just apply this cuff. That's it. Okay. Now, I'm just going to put this stethoscope around your elbow region, your brachial pulse, in the bicep area there. That's it, just under that cuff. Alright, this little dial's going to tell me when to start and stop. Okay. Just going to feel some pressure in your elbow region. It's going to inflate this one with our pump. Okay, here we go. Nearly there. Okay. Just releasing that air. Alright. There we are. All that air should be gone now. So, blood pressure's looking normal as well. It doesn't sound like historically you've had any issues with that, but always good to keep track of and have a record of. So I'll record that for you today. But I'll just get that cuff off you. There we go. All right. Now, let's check your coordination while we're at it. So, I'd like you to go touch your nose with your index finger and then touching my finger here. So touching your nose to finger, nose to finger, nose to finger. Okay, go for it. All right, nose, finger, good. 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 Okay. Alright, excellent. And next one, just trying to touch each finger with your thumb, like so. Call this opposition of the thumb. Common coordination test, yeah. So just like this. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Okay. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Very good. Alright, and then lastly, just with your hands, moving them like so. Palm facing me, palm facing you. That's it. And then alternating left and right, One facing away, one facing you. Okay, and try to do that as fast as you can for me. Nice work. Good job. Alright, and then just putting my hand on your forehead there. Okay. Nice. Even temperature there. Slightly warm, but not feverish. You've been feeling fine. No temperature lately. Night sweats. Cold sweats. Okay. Very good. Alright then, let's have a look at your neck movements. Just lastly, just next, looking up towards the ceiling, like so. Good. Up and down. Up and down. Alright, now this way, like so. Okay, and this way, like so. Alright, nice work. Now just in a circle, nice big circle. That's it. Excellent. Alright, now just against my resistance now. That's it, push against me. Nice, one more time. Push against me. And then this way, against my resistance. Go, 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 go. Push through me. Okay. Alright, now try to bring your chin towards your chest. Good. Push through me. Good. And then bringing your head backwards, looking up against my pressure. That's good. Nice work. Okay. Just on top of your shoulders now. And through here, try to shrug against my pressure. Okay. Shrug, shrug, shrug. Good. And again. Nice. One more time. Lift up, lift up. Good. Adequate strength in there. Lastly, your grip strength. Just try to squeeze my finger as hard as you can. Okay? Go. Nice work. And just with your other hand now, squeezing my finger with your hand. Good. Nice strong grip. Very good. And that's relatively equal on both sides. Good to see the symmetry. Alright. We've gone through a lot there. Take a break. Some deep breathing maybe. I'll just jot this all down and make a note of all that. Okay. Good. Good. Alright, we're nearly done. I just want to check your sensation. You haven't been experiencing any pins and needles or tingling sensations? No numbness? Okay. Alright, we'll just check your facial sensation for today. Just got my little cotton balls here. Here we are. Cotton ball number 1. That's all we need. Just going to apply that little bud onto the eyebrow there, like so. Good. You know what that feels like now. Hard part, I'd like you to close your eyes. That's it. Close your eyes. No peeking. Alright. Let me know when you can feel the sensation of the cotton bud. Okay. Alright, here we go. 1. That's right, that's your eyebrows. And again. Good. Yes, that's your other eyebrow. Alright, now what about here? Good, that's your forehead. Okay, now, just in this spot now. That's right, that's your nose. And then over here. Good. Your cheek. What about here? That's right, your other cheek. Okay, one more spot. It's your chin. Okay. So, all those sensations seem to be intact. Pleased to report. And I'll just jot down all my findings and I'll report back to you. So, there was one last test before I collate this data. Can you remember the 3 words I told you to say from earlier? That's right, the little memory test. Can you say them for me? That's right, apple, penny, table. Correct, apple, penny, table. Good job. Well, I'm pleased to report that from everything we've tested today, all your vitals are stable, your strength and joint movements are all within normal limits, your breathing comfortable, your eye reflexes and ears are all fine, nothing abnormal detected. Generally, your presentation is as it should be, which is very reassuring. What I would recommend is to keep doing what you're doing. Keep looking after yourself like you have been, taking the time to stay hydrated, ensure you have adequate amounts of sleep and rest and recovery. All of these things are clearly helping you, and you've presented to me today in excellent condition and health. So, congratulations to you, and a good pat on the back. Keep up the good work. Now, that's all I had to look at today, but feel free to take your time. No point in leaving if you're feeling relaxed. My next patient isn't for a little while longer anyway. So, if you want to stay, there's no rush. I'll just be here typing up my notes. But yeah, okay. Thank you to my awesome patrons, Andres Erland Vasquez, James, Astor, Scott Walker, Kirsten, Josh, Patrick, Gabriel C., Will Hume, Emma, Here's Mikey, Chad Moore, James P., Taylor,